So we have the Public Sector Scaling Action Lab that really is a group that started almost as something that you'd call a community of practice, but with action added to it. Enthusiasts or champions who actually believe that there are solutions that can come through innovations and scale through public sector.
For a long time, we have been really passionate about helping governments source and adopt innovations into their systems on a regular sort of systematic basis so that they can tackle the many complex challenges that the world is throwing at health systems today.
When looking at a PHC, basically the principles of a PHC is giving universal access of health to people in a manner that is acceptable to them at a time that they need it and at a cost that they can afford. Because we know most of our building blocks have deficiency, so if we are not innovative, we cannot achieve this.
The biggest challenge to me with Kenya is not finding innovative solutions. The problem is finding ways to fund this and scale, finding ways of embedding this within frameworks that allow them to reach the bulk of the population. And really that's the reason why the Public Sector Scaling Action Lab and Open Fences and Insert Health Advisors are doing what they are trying to do with the policy ecosystem in Kenya.
In a mutually symbiotic kind of relationship. That was just a follow-up.
The private sector has to understand what the user needs in terms of what the public needs, what the government needs in terms of innovations, so that it's demand-driven as opposed to innovator-driven, and also understand government processes, so that even while engaging government, you're aware of the processes that you need so that you can get on board with either the procurement process or even the public partnership process.
So the Mountain Model is a framework that was developed out of a research that was done in Kenya and Sub-Saharan Africa. And this research was asking the main question of what are the challenges in public sector scaling. Based on those challenges, we developed the Mountain Model. So the Mountain Model tries to tackle several challenges. One is supplier-driven innovations, ensuring that the county is clearly in the driving seat in expressing their needs, their gaps, and translating those needs and gaps into a language that an innovator understands as an investment and an innovation opportunity. And finally, institutionalizing this process so that counties can reiterate the whole process again every time they have a need or a gap. They can start at demand articulation instead of quickly shopping for innovations before they are clear what they need.
There was no clear way of identifying and really owning up these innovations. I think the opportunities are numerous. Now with this demand-driven mechanism, we set the priorities when we were beginning the Mountain Model approach, and we have the needs that we identified, so we can be able now going forward to track our journey in the innovation area.
What we are doing currently, especially with our Kenya Primary Healthcare Networks guideline, is that we are giving a methodology which we looked at several countries, almost 15 countries, what they're doing in the space of PHC. And then we tried and come up with what we are calling the hub and spoke model, what we are calling the PCNs, which basically just bringing in comprehensive integrated services, looking at the team, the governance. So currently what it proposes is a multidisciplinary team that works with the level 4, which we are calling the hub, the level 3, 2, and 1, which we are calling the spokes, so that actually the levels are talking and they're not working vertical or in silo. Instead of having, for example, a very vertical HIV program, we want to use the same resources. At the same time where the HIV is being provided, the same officer can still look at the person with pneumonia. Has come with HIV but has pneumonia, so he doesn't want to send to other places. So the issue of services being taken to the lower level is very integral in this primary healthcare network. So I think the government is bringing in a different approach. We are glad several counties are already implementing.
We've made a little bit of adjustments to ensure that our primary care networks then speak to the community needs as opposed to just being what is on the document. Digitalization is part of the broader agenda for digital health that Kisumu County has a vision on. Through support from the national government and with our implementing partners, we have trained our community health workers, and so that they are able to collect data through a digital tool. And through that, then there are dashboards that reflect the data that is collected. It's made household visits very easy, but also improved the accuracy of data.
A lot of the stars are aligning in Kenya at the moment. You have a great appetite and interest in innovation among many county governments. You have a national Ministry of Health that is very supportive of using innovation to get to the SDG goals and other government policy targets. And you have a fantastic network of local actors on the ground, who we call our champions within the Public Sector Scaling Lab, who are really experts in holding the hand of government, in facilitating the process of sourcing and scaling innovations. We are actually also exploring Ethiopia, a very similar model, but of course that's at national level. And so we're using the learning from Kenya to inform Ethiopia and vice versa as well. And it's a fascinating learning study for us as we all learn about this process.
Ultimately, I'd like to see counties feeling like they are free to look for resources from other quarters, because the national resource allocation cake, however well-intentioned, will never be enough to meet the growing health needs and demands. So in 3 to 5 years, I'd like to see counties being a bit more brave in looking at alternative forms of attracting investments through innovation investment cases, and doing so successfully without worrying about, the broader structural challenges that could stop that from happening.